Hello everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at dural venous sinuses. So by the end of this video, you should be able to describe the formation and location of the major dural venous sinuses. You should be able to trace the flow of venous blood from cerebral veins to the internal jugular vein, and as well explain clinical significance of hemispheric vein and cavernous sinus infections. So what are dural venous sinuses? They are endothelial-lined valveless channels between the periosteal and the meningeal layers of the dura mater. The meninges, we have the dura, we have the arachnoid, and we have the pia mater. So the dura in the brain has two layers, where we have the periosteal and the meningeal layer. So in between these two layers of the dura is the venous sinuses, like the superior sagittal sinus. So the key difference between these dural venous sinuses and a typical vein is that they do not have smooth muscles, they are rigid and non-collapsible channels which are held by dural tension. So that's the difference between the dural venous sinuses and the typical veins. No smooth muscle, they are rigid and non-collapsible. So now, what's the function of these dural venous sinuses? They drain deoxygenated blood from the brain and also drain cerebrospinal fluid through the arachnoid granulations. The key features, like I said earlier, they are valveless. So for this reason, they allow bidirectional fluid. Blood can move from one direction to the other and vice versa. This is important for spread of infection. So now look at the major dural venous sinuses. And the major dural venous sinuses, are going to group them into three groups. The first group are those sinuses at the falx cerebri. Now the falx cerebri is a fold of dura mater which divides the cerebral hemispheres into two, separates the right and the left cerebral hemispheres. Now in this image you see the falx cerebri is located here. Above the falx cerebri we have the superior sagittal sinus, and at the free lower edge we have the inferior sagittal sinus. So the superior sagittal sinus is located at the superior border of the falx cerebri, and it extends from the crista galli anteriorly to the internal occipital protuberance posteriorly. We also have the superior cerebral veins that receive cerebrospinal fluid through the granulations. Then we have the inferior sagittal sinus, which is a free inferior edge, is located at the free inferior edge of the falx cerebri, and veins from the corpus callosum and cingulate gyrus drain into this vein, into this sinus. If you look at this image, you see the falx cerebri here, the superior sagittal sinus, as well as the inferior sagittal sinus. Now the next sinuses we have are sinuses at the tentorium cerebelli, and here we have the straight sinus, which you can see in this image, the straight sinus. We have the transverse sinus, which are two on the right and on the left. This is the transverse sinus. This is one on the left, this is another one on the right. We have the sigmoid sinus, which is a continuation of the transverse sinus, and we have the transverse sinus to the sigmoid sinus to the internal jugular vein. Now from the image you see that this straight sinus is located at the junction of the falx cerebri and the tentorium cerebelli. The straight sinus located at the junction of the falx cerebri and the tentorium cerebelli. So we have the transverse sinus, which I said is on the right side and the left side. That means there are two, and it grows in the occipital bone and runs laterally to meet at originating from the confluence of sinuses to the transverse, then sigmoid, and it is often larger on the right, which means the right transverse sinus is often larger than the left transverse sinus. And we already said the sigmoid sinus is S-shaped and is a continuation of the transverse sinus. we have the transverse sinus, which drains into the sigmoid and the internal jugular vein, and it passes through the jugular foramen. That's the internal jugular vein passes through the jugular foramen. So we have the confluence of sinuses here, which is what we refer to as the tubular hierophyllae. So this is what we have. We have the superior sagittal sinus. We've already talked about this. We have the inferior sagittal sinus. We have the straight sinus. We have the transverse sinus, which continues as the sigmoid sinus, then into the internal jugular vein. And we have the great cerebral veins, which drain blood into these short veins. Now we have the third group of sinuses, which are the cavernous sinus, and is located in the sella turcica, lateral to the sphenoid body. I know that at the body of the sphenoid, the sella turcica, we have the pituitary gland. If you see from this image, we have the pituitary gland in that space of sella turcica. So the cavernous sinus is what you have on the right side and the left side of this pituitary gland. This is the cavernous sinus. So it has structures that it contains, and we remember these structures with old tomcat. That is the oculomotor nerve, the trochlear nerve, the ophthalmic division of trigeminal nerve, as well as the maxillary division of trigeminal nerve. And trigeminal nerve is a fifth cranial nerve. We also have the carotid artery as well as the abducens nerve. Now, when we talk about the content of the cavernous sinus, we have structures that are located on the lateral border, and we have structures that are found within it. For structures that are located on the lateral border, from superior to inferior, we have the oculomotor, we have the trochlea, we have the ophthalmic and maxillary divisions of the trigeminal nerve. As you can see in this image, they are on the lateral side, while within it we have the internal carotid artery as well as the abducens nerve, which is found within the cavernous sinus. Now, what are the tributaries of the cavernous sinus? We have the superior and inferior ophthalmic veins, we have the sphenoparietal sinus, and we have the central retinal vein, which drains the blood from the eyes, the retina. Then the drainage system of the cavernous sinus is through the superior and inferior petrosal sinuses, which drain either into the sigmoid sinus or into the transverse sinus, and rarely in some cases it drains directly. Specifically the inferior petrosal sinus drains into the internal jugular vein directly. So now, looking at other important sinuses, we have the occipital sinus, which is small and runs in the falx cerebelli. It drains into the confluence of sinuses. And the confluence of sinuses is what we call the tubular hierophyllae. It's a meeting point of the superior sagittal sinus, the straight sinus, the occipital sinus, as well as the transverse sinuses. If you look at this image, like we have said here earlier, this is the confluence of sinuses. So we have the sphenoparietal, which follows the lesser wing of sphenoid into the cavernous sinus, and we have the superior and inferior petrosa, which we already said connects the cavernous sinus to the transverse through the sigmoid as well as the internal jugular veins. Now, the flow of blood is as follows. You have the venous blood moving from superior sagittal sinus to the confluence of sinuses, from the confluence of sinuses to the transverse sinus, from the transverse sinus to sigmoid to internal jugular vein. While from the inferior sagittal sinus, venous blood moves to the straight sinus, from straight sinus to the confluence of sinuses. From the confluence of sinuses, it follows the same pattern: transverse, sigmoid, internal jugular. While from the cavernous sinus, the flow of blood may follow two paths: one through the superior petrosa and another through the inferior petrosa. When it follows through the superior petrosa, it drains into the transverse sinus, which moves, as we see above, to the sigmoid and the internal jugular, while to the inferior petrosa might drain to the internal jugular vein, or it can also sometimes drain through the sigmoid sinus. So now, what are the clinical relevance of this information? We have a group of veins which we refer to as emissary veins. They are valveless veins that connect the dura sinuses to the extracranial veins. And the dura sinuses, we already know they are inside the cranium, while there are other veins that are located extracranially. So the emissary veins, which are valveless, help to connect these intracranial veins, which are the dural venous sinuses, to the extracranial veins, and this allows for infection spread from the face at the danger area of the face. I'm going to make a video on the danger area of the face, so look at that subsequently. But you know that infection from the danger area of the face can drain to the cavernous sinus with the aid of the emissary veins, which are valveless. And you know, when they are valveless, they allow for bidirectional flow. For example, we have the mastoid emissary vein that connects the sigmoid sinus to the posterior auricular vein. We also have cavernous sinus thrombosis. This is formation of a thrombus in the cavernous sinus, and when this happens, you have spread of infection from a facial furuncle. And when we talk about a facial furuncle, we're talking about something like a pimple or a swelling or furuncle on the face, and we also have dental abscess as well as sphenoid sinusitis. In this situation, there could be spread of infection, and this infection can spread and cause proptosis. And proptosis, we know it's the protrusion of the eyes, which you can also be referred to as exophthalmos. It can also cause chemosis, and chemosis is edema, collection of fluid in the conjunctiva. It can also cause ophthalmoplasia due to affectation of cranial nerve 3, 4, and 6 palsy. It can also cause facial sensory loss because of affectation of the ophthalmic and maxillary divisions of the trigeminal nerve. So why is this dangerous? The internal carotid artery internal can cause the result in thrombosis, which can lead to stroke because it can cause an obstruction of a blood vessel in the brain and can cause stroke, as well as septicemia due to spread of infection. So this is connection of the ophthalmic, facial vein, cavernous sinus, internal jugular vein, transverse sinus, inferior petrosal sinus, superior petrosal sinus, and the intercavernous sinus. So we can also have an elevated intracranial pressure. This can lead to papilledema, which is collection of fluid in the optic disc, a swelling of the optic disc, basically due to collection of fluid, edema. So when there's increased intracranial pressure in the superior sagittal sinus, this can cause can be blocked due to blockage of the arachnoid granulations, which is a drainage site for CSF. So whenever this drainage site is being blocked, CSF drainage is impeded. It then now results in increase in intracranial pressure, which causes venous congestion and optic disc swelling, which is what we refer to as papilledema. So venous infarct, they can be sinus thrombosis due to, for example, people who are in a hypercoagulable state, can cause increased venous pressure and hemorrhagic infarction. So in summary, we know that the dural venous sinuses are valveless, and they contain, or they possess, emissary veins that connect these dural venous sinuses to the extracranial environment and will serve as a route for spread of infection as well as emboli. We have cavernous sinus, which is serving as a clinical crossroads. You need to know its content, and you need to know the connections, both the tributaries and the drainage of the cavernous sinus. We have the arachnoid granulations that drain CSF into the superior sagittal sinus, and very important for CSF reabsorption. And remember, we said they do not possess smooth muscles. Sinuses do not possess smooth muscle. Sinuses collapse with raised intracranial pressure, therefore worsening venous congestion. Thank you for watching. Make sure to like, share, and subscribe to Alacrity Explains Anatomy.